My name is Terry Mamounas. I'm the medical director of the Comprehensive Breast Program at Orlando Health Cancer Institute, and I'm a breast surgical oncologist by training. So the question is, what factors predict that patients will not have a satisfactory reconstructive outcome with a breast implant following mastectomy? And obviously, there are several factors that predict for development of complications and unsatisfactory outcomes following implant reconstruction after mastectomy. There is of complications which in turn obviously can affect patient satisfaction with implant reconstruction. Some of the risks are smoking, older age, obesity have been found to increase a risk of complications and eventually unsatisfactory cosmetic outcome. Pretty much smoking, older age, and obesity almost double the risk of complications after implant reconstruction. And other comorbidities of the patient, which obviously come with the older age as well, it's such as diabetes, vascular disease, hypertension can increase the complication rate. Anything that affects blood supply of the flaps and around the implant can decrease the cosmetic satisfaction from the implant. Also, a very important factor is use of radiotherapy that can also increase the complications, which may be due to infection, implant loss, or need for implant expander loss or replacement. And eventually, radiation also leads to a poorer cosmetic outcome because of the potential for fibrosis developing around the implant. And so patients that actually are candidates for radiotherapy after mastectomy, obviously it doesn't mean that they cannot get implant-based reconstruction, but they should be aware that sometimes the implants may become more asymmetric as time goes by. The implant that is the radiated implant, the capsule around that implant can fibrose. The implant can lift a little bit. There could be asymmetry over the years, having one more lifted versus the other. And that's difficult to fix. Even if you were to remove and replace the implant, the same phenomenon will occur because it's related to the tissue having been radiated and cause significant fibrosis. So we actually counsel the patients that we think they're going to require radiation, and we try to steer them more towards autologous flap reconstruction, which is taking abdominal fat and putting it in the breast to reconstruct, which actually brings fresh tissue and doesn't have the same effect of the foreign body reaction around the capsule of the implant. But again, as I said before, if a patient is insistent on having implant-based reconstruction, even with radiation, we of course counsel them about it. And then, if there's an asymmetry, sometimes you may do something on the other side to fix that. But in general, radiation is an issue that complicates the implant placement with, again, complications in terms of infection, implant loss, implant need to be replaced, and also expander loss sometimes before the implant goes there. So these are some of the reasons why patients will not have a satisfactory reconstructive outcome. And as I mentioned, of course, before, for post-pectoral implants, one of the adverse outcome cosmetically is also this animation deformity, where the breast kind of shrinks every time you contract your pectoralis muscle. But again, that can be fixed by using prepectoral implants, and people do pretty well with that.